What is cardiac arrest? The causes and how to avoid it. Cardiac arrest is a sudden and complete loss of heart function, meaning the heart stops beating effectively. When this happens, blood stops flowing to the brain and other vital organs, and the person becomes unconscious within seconds. Without immediate treatment, cardiac arrest can lead to death within minutes. These terms are often confused, but they are not the same. Heart attack, a blood flow blockage, damages the heart muscle. Cardiac arrest, the heart stops beating due to an electrical malfunction. It may or may not be caused by a heart attack. Cardiac arrest is usually caused by a problem with the heart's electrical system. The most common causes include arrhythmias, abnormal heart rhythms, ventricular fibrillation, VF, the most common and deadly type. The heart quivers instead of pumping blood. Ventricular tachycardia, very fast heart rate that can turn into VF. Heart conditions. Coronary artery disease, CAD, most common underlying cause. Heart attack, myocardial infarction, can trigger electrical instability. Cardiomyopathy, disease of the heart muscle. Heart failure, weak heart function can lead to arrest. Congenital heart defects, especially in children or young adults. External factors. Severe blood loss or trauma, drowning, electrocution, drug overdose, especially opioids or stimulants. Severe electrolyte imbalance, like potassium or magnesium. Warning signs before cardiac arrest. Sometimes it happens without warning, but possible signs can include chest pain or discomfort, shortness of breath, dizziness or fainting, palpitations, feeling of rapid or irregular heartbeat. How to lower your risk of cardiac arrest. Keep your heart healthy. Eat a heart-healthy diet. Focus on fruits, vegetables, whole grains, lean protein, and healthy fats, like those from nuts or olive oil. Limit salt, sugar, and saturated fats. These contribute to high blood pressure and cholesterol. Avoid or quit smoking. Smoking damages blood vessels and increases the risk of arrhythmias and heart disease. Drink alcohol in moderation. Excessive drinking can trigger arrhythmias and heart failure. 1. Exercise regularly. Aim for at least 150 minutes per week of moderate aerobic activity, like brisk walking or cycling. Include some strength training 2 times per week. 1. Control medical conditions. High blood pressure. Keep it in check with lifestyle and/or medications. High cholesterol. Manage it through diet, exercise, and statins if prescribed. Diabetes. Control blood sugar through diet, medication, and exercise. Heart disease. If you already have it, take medications and follow your doctor's advice closely. 4. Avoid triggers that can cause arrhythmias. Don't misuse drugs like cocaine, meth, or even some prescription meds without guidance. Avoid electrolyte imbalances by staying hydrated and maintaining a balanced diet. Be cautious if you have known genetic heart conditions. Follow your cardiologist's advice. Know your family history. Some people have inherited conditions like long QT syndrome, Brugada syndrome, or hypertrophic cardiomyopathy that can increase risk. If there's a family history of sudden cardiac death, talk to a cardiologist and consider genetic testing or screening. Subscribe, like, and follow to know more about your body.